Hi everyone. So today I have the honor of introducing to you Dr. Bharath Kathi. I'm sure you already know him. He is one of the most favorite respiratory medicine faculty in the country, not only for undergraduates. And that is the beauty of it. He's not only the favorite faculty for undergraduates, now he's the favorite faculty for postgraduates. And almost all, and I'm very proud to say, almost all respiratory medicine are today studying with him in the DAMS Medicine Residency course, and which makes me very proud. And Dr. Bharat is a great friend, great teacher, great human being. So, Bharat, such a pleasure to share the stage with you today. And I want to congratulate you on the massive number of students and the residents who are studying with you in your course now. How does that feel?
Sir, good evening, sir. Really, it's my honor, sir, to be alongside with you. So you were the one who have given me the opportunity in 2015 when I wanted to teach, and later resident course you and Deepthi madam has given that push, do it. So when we were thinking of doing some classes like one or two sessions, you told us that let it be a big platform so that everybody can utilize it. So now I am very proud to mention that we are having the biggest library for pulmonology in the world, sir. So no
Awesome.
other course is providing more than 300 courses with relevant notes, with NEET SS modules, and also separate practical exam modules, sir. And the app that you have created and the platform that you have given to us, we are really thankful, sir.
And Dr. Bharat, today I have a lot of questions that the resident doctors have asked me to ask you. First question
Sir.
is, sir, I am a first year resident in respiratory medicine. How should I utilize your course? What topics, what videos in your course should I go through at that stage?
So first thing, sir, most of the students who take up respiratory medicine, so they'll be having in their mind to get into general medicine. So by the time they reach the respiratory medicine ward, so their minds are tuned to be a physician. And one important thing in respiratory medicine in our country is it is generally very hectic, sir. First year they'll have lot of duties to do, and they should get adjusted to the work environment. And moreover, we have many emergency procedures also being done bedside, such as ICD, pleural aspiration, intubation, all those. So to make sure in their limited time to get the maximum benefit, so we have created first year resident corner separately in the app. So it
Awesome.
has all the videos which is required for a first year postgraduate to survive the ward rounds, to survive the emergency department, and also to make them confident that they can handle a patient very well. And also we have included few rapid revision videos and also practical examination videos. So these videos will give them confidence so that their first year residency, even though it is hectic, they will get a crisp content to apply it on a given patient.
And Dr. Bharat, what about second year, the thesis year? Then how should I use? Look, if I remember my own residency, second year was the time when we start getting serious about studying.
Yes, sir. And moreover, sir, now the focus has shifted from simple MD or DNB respiratory medicine to fellowships and also European exams and also DM pulmonology. So what I have recognized is over the span of last 2 to 3 years that I have interacted with students, most of the people clearing their European exams or fellowships or DM, they have started from their second year onwards. So they were sincere and spending round about 4 to 5 hours per day. So I say that if you are looking forward some 3 or 4 years that I want to be like this, you have to start it from your second year. And once you start it from second year, you will have sufficient time to cover the theory, to cover the practicals, and to cover the material required to do any MCQ exam in the country and also abroad, sir.
And then I come to the most important question actually for the entire video is, suppose I'm a third year resident and I'm MD or DNB, and I want you to address both of them separately also because there will be some differences in the
Yes.
DNB, always you have that fear in your mind about the exam. So then how should I use your course for passing the exam?
Okay, sir. You won't believe, sir. There are students who still message me, sir. We didn't come across the course previously. We have taken late, but just seeing the course for the last 1 or 2 months, we could clear the exam. Because in the course there is a section called as one page digest, which has round about 170 essay questions, sir, which you can complete it in 5 minutes time. Just 5 minutes. If you just go through that notes with my voice playing around, so you will know which point to stress upon. Most important thing in residency is not just learning, knowing how to write it on the paper, sir, because there will be round about 20 questions. Even if you know about one question completely, that is not going to give you 100 marks. That will only give you maximum 70 to 80% awarded to that question. So most of the residents stumble there. So we have created a section called as one page digest, which contains anatomy, physiology, pharmacology, therapeutics, diagnostics, and recent advances, where you will be given how much you need to know to write in the final exam. So this many students have told me that, sir, this OPDs are a lifesaver. We could easily complete these topics, which generally take hours and hours of preparation. We could do it in minutes, sir. So this was a game changer for many students, sir, especially final year residents.
So if I say in a nutshell that you've kind of covered the entire ground for different parts of the residency, and if I'm a
Yes.
student beginning the residency or ending, the courses has material for both of them.
Yes, sir. And most of these days, I get queries from people who have completed MD. They want to do DNB exam, and most probably in their senior residency, they'll be having around about 6 months time. So they wish to complete their DNB exam, and they wish to complete their European exam. So for them also, now this course has become a bridge, so that the crisp material, everything which is available, they can easily write the theory exam, and the SS super specialty MCQ modules and virtual OSCE clinical scenarios, which are favorite for not only DNB exam but also for European exams, have been incorporated. And once they see it, they will get the feeling of that they're actually doing an virtual exam. So in this way, even after completion of MD, most of the students are trying to cover these topics and clear their DNB and European exams very easily, sir.
So
So that
if
is
I may
something very happy.
So if I may say, Bharat, that means your course is enough not only for their MD final or DNP final, it also helps them in their NEET SS, European
Yes,
exams,
sir.
and
Yes, sir.
also helps them to become a good clinician.
Yes, sir. Definitely, sir. Most of the people now they call me at some point of time, telling that, sir, when I was seeing this patient, I could remember the concept that have you have clearly explained in video. Now I could identify this finding and I could come to a logical conclusion. And one more thing, sir. Now the students of DM pulmonology are also joining the resident pulmonology course. I don't know why I have called it as resident pulmonology all in one. Now it really has become an all in one course, sir.
Yeah, perfect. Actually, I think what you're doing is through your course, you are actually creating that bridge, that there is a chasm or a gap in between the level or the standards of medical healthcare required globally versus what is being taught in various institutes because of disparity, different places in the country. And you are being the bridge so that every respiratory resident gets the same quality of teaching, gets the same quality of learning from the best teacher possible. So, Bharat, you're doing actually social service by doing all this, and I'm very proud to be your friend and a
Sir,
fellow educator. It is such
sir,
a great thing to do.
Sir, it is always my great honor, sir, because when I started the course, live course, the video library was only about 10 to 20 videos. But first year itself, nearly 800 residents have joined, sir. So without any question, just the confidence that they had in me, because I was a part and parcel of dams for the last 10 years. because of their confidence, it gave me motivation that I should do something better to them, sir. So I have just tried my level best to make sure every resident passing out the exam is having the same standard of knowledge that is required to practice in a country like India, sir. And I'm also happy to share that residents from Middle East, residents from Europe are also joining the course, sir, and they are also utilizing it to for their clinical practice, sir. I'm really honored for this reception, sir.
I totally believe it should become one of the global bestsellers in respiratory medicine in times to come. So,
Yes,
Dr.
sir.
Bharat,
I'll try my best, sir.
on that note, any final message for respiratory residents who are in any stage, anything that you want to share with them from your experience, from your journey, that would help them to become better doctors and better specialists?
So, what I have understood in the last 10 years, sir, when comparing all the other medical fields, respiratory medicine is one field where innovations has changed the field completely. Because 10 years, what we are doing, 10 years now, is completely different when it comes to interventions, when it comes to sleep medicine, when it comes to allergy, immunotherapy, when it comes to critical care. But at the end of the day, whatever advances you learn, you should be strong in your basics. So only once you are a strong clinician, you will be a good pulmonologist. Only once you are a good pulmonologist, you will be a better interventional pulmonologist. So all these steps you have to follow. This is the natural course how a good doctor is being built. And respiratory medicine is the best example. If you start from basics, have confidence in you, you can do all the procedures that are being done in the most advanced center also, sir.
And I totally agree with you. If you have the foundation of knowledge, then you can add the ability of skills and
Yes,
your
sir.
interpersonal skills and then the person that you are. But if you don't have knowledge, then you are standing on shaking ground. You need that
Yes, sir.
knowledge,
True, sir.
then skills, then your other personal skills like how you talk, how you speak, how you present, how you research. There are many things to be done to become a top doctor like you. But the bottom has to be the knowledge, and that knowledge partner. I am so happy that Dr. Bharat's course is now the most popular course in for respiratory residents in the country, and I'm sure it will become one of the most popular course in the world in near future. On that note, Dr.
Thank
Bharat,
you,
I
sir.
wish you all the best. It is such a pleasure to always talk to you and keep guiding students. I think you are a guiding light for so many residents, Doctor, now.
Sir, always my honor, sir, to share this stage with you, and it will be my biggest responsibility to guide the residents of the country, sir. Thank you so much, sir.